everybody. Welcome to Nursing the Livingston Way. My name is Susan Livingston. Let's see what we're going to talk about today. Oh, yes, back by popular demand, a former student wanted me to present this. She learned it in class from me years ago. She never forgot it. She said, people probably benefit from it, Miss Livingston. Put it on your YouTube channel. So what we're going to talk about is the medication called Digoxin and how it helps a failing heart, a congestive heart failure heart. This is not an in-depth video on digoxin itself. We're not going to talk about side effects and how to administer it and this, that, and the other. We're just going to see how it actually helps the congestive heart failure heart. So let's get unconfused and let's have some fun. Okay, a strong heart, a strong beating heart. Look at that baby pumping. We want a strong heart, and a strong heart will have a strong contraction or a strong push or a strong pump. And that's wonderful. And if it has a strong contraction, it'll have a normal rate of 60 to 100 beats a minute in an adult at rest. It will beat faster when you're active, but at rest, it should have a resting heart rate of 60 to 100 beats a minute. And when it does, it's able to circulate blood around your body and the blood vessels like it should. So let me give you an example of what a strong heart would look like. Push, 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 push. That's what we want. Now, a congestive heart failure heart, CHF, also known as simply heart failure. Things are going to change in a congestive heart failure heart. It's a chronic condition. Once you are diagnosed with it, you will always have it. You will battle it for the rest of your life, but it can be controlled with medications and lifestyle changes. And what is happening with the congestive heart failure heart is the heart muscle, the myocardium, becomes very weak or very stiff. And that's going to change the way it pumps, and it's going to change the rate at which it pumps. So the congestive heart failure heart will not beat strongly. It'll be very, very weak. And because of it, it will increase its rate out of necessity to compensate. It will become tachycardic. So no longer will we be 60 to 100 beats a minute at rest. We'll be over 100, maybe 105, 110, 120, 130 out of necessity. And because of that, the client will swell up with fluid or become congested. And that's where the word congestive heart failure comes from. They will swell up with fluid and become edematous, okay, from the weak heart. And I'm going to show you what a weak tachycardic heart would look like. Now remember, the regular heart, the strong heart, would be like this: pump, pump, pump. But let's see what the heart failure heart would look like. Fast, fast, fast and weak, fast, fast, fast and weak, fast, fast, fast and weak, fast, fast, fast and weak. And the poor heart says, I'm in heart failure, I don't pump very strong, and I beat really fast, and I'm exhausted. So that would be so cool to have a medicine that can help that heart beat stronger and slow down. And there is a medicine. And that medicine's name is Digoxin. Okay, and let's just see how that's going to help us. And for short, nurses call Digoxin Dig. Okay, now we have to get some things under our belt real quick, and you're going to see some words here, and yes, you're going to have to memorize them. You'll need to know them. They were on my NCLEX, I remember that, so I had to memorize it too. So any medicine that affects the myocardial contraction or the pumping ability is called an inotropic medicine. Okay, now I'll give you a hint for that here in just a minute. Any medication that affects the heart rate, how fast or how slow the heart is going to pump, is called a chronotropic medication. Okay, now here are your hints. Inotropic. I want you to see the letters I-N-O. I know. And I want you to go down here and say, I know. I know the heart should pump strong. I know the heart should pump strong. So an inotropic medicine helps the heart beat strong. I know that. Chronotropic medicine You see the HR in here? HR right in there. Heart rate. So a chronotropic medication with HR in the name affects the heart rate. And that's how you can remember chronotropic. Okay? All right. Let's see what happens when digoxin binds to receptor sites in the heart. So let me draw for you so you can understand this. Okay. Here's the bloodstream. And every cell of the body has receptor sites on them, or parking spaces, where medication will go and bind or attach or park, or hormones or whatever would go there and attach and park on those cells, and the medicine or the hormones would exert a therapeutic effect. So here's the bloodstream. Here's your congestive heart failure, your weak tachycardic heart. Let's take some digoxin, and I'll say D for dig, flowing around in the bloodstream. And let's put some receptor sites or parking spaces on my congestive heart failure heart. And digoxin is going to park in these spaces. So this dig is going to park here. This dig is going to park here. And this dig is going to park here. And when it does, it's going to have some therapeutic effects for this heart failure heart. So let's see what's going to happen once the digoxin binds. Okay. First off, and we love this, it's going to have a negative chronotropic effect. And there is the word, and it's got HR in it. And that means something to do with the heart rate. And it is a negative chronotropic effect, which means it is going to decrease the heart rate. Good, because my congestive heart failure heart is very tachycardic and it is exhausted, and it would love some help to make it slow down so it could rest and not be so tired. So we like that. And when it decreases the heart rate, it takes it from something tachycardic to something normal, say from 110 to 60 to 100 beats a minute. Okay, we don't want it to take it too low, but we do want it to lower it back to normal. And so my heart can be very happy about that. So it slows it down. The second thing it does is has a positive inotropic effect. Now there are the letters I know, and I know that I should have a strong pump. So it's a positive effect, which means it's going to increase the pumping action of the heart. Oh, my heart says, yay, yay, you slowed me down and you're helping me push stronger. So punch it out, baby. Slow it down and punch it out. Slow it down and punch it out, baby. That's what digoxin does. And it goes something like this. So if you had a congestive heart failure heart that's going, I'm weak and tachycardic, I'm weak and tachycardic, somebody help me, please. Where's the digoxin? Where's the digoxin? Digoxin comes in and slows it down. And it gives me that strong pump. Slow it down and punch it out, baby. And that is how digoxin works in the congestive heart failure heart, by having the negative chronotropic effect and the positive inotropic effect. So thank you for watching. Don't forget to hit subscribe and leave me some comments on things I can help you with. I'm here to help you, would love to, and I'll see you next time. Thank you.